Hello everyone. I am Dr. Saurabh Sadekar, consultant neurologist from Manipal Hospital, Bangalore. And today we'll be talking about epilepsy and associated learning disabilities or intellectual disabilities, as we say. So, epilepsy is a disorder that involves a constellation of symptoms that vary in frequency and intensity from child to child. Of those children with epilepsy, approximately 25% continue to have a poor seizure control despite being on seizure medicines. In addition to this, they continue to have uh, problems in other multiple domains like cognition, academic performance, social behavior, social hobbies, interests, and otherwise in the routine development. That is because even when seizures are well controlled with these medications, the problems do persist because they may have an underlying abnormal brain malformation or abnormal brain function. And on top of it, the anti seizure medicines per se do cause some amount of sedation or drowsiness or slowness in day to day activities. Although overall intellectual ability in children with epilepsy is comparable to those with normal childhood population, they are at a greater risk of developing learning problems and poor academic performance as compared to other children. Even in those with normal intelligence, reports of deficits in specific areas related to thinking, memory processing, speed of perception, speed of speech formation is well established. In such children, organizational skills and academic achievements also might be poor. Indeed, many children do not fit the typical school definition of learning disabilities as their reading, spelling, or writing may be appropriately developed. But however, they do have significant challenges for developing particular areas which are needed for academic excellence. So common learning challenges in such children are like paying attention, focusing concentration, understanding certain instructions, using information to carry out tasks, describing things to other people, short term memory, working out how to do something new, organizing thoughts, feeling that you have no energy to do things, feeling muddled or always remaining confused, mood disturbances, quite prominent, like sometimes being short tempered, sometimes grumpy, sometimes working out sums, writing or copying figures, and developmental delays are also possible. Learning is important for people of all ages, not just children. Likewise, the impact of epilepsy can be experienced at any age. The extent of the impact varies from person to person or from child to child, and it depends upon which kind of epilepsy the patient has and which kind of medications are being used. The impact that epilepsy has on the patient's learning can be related also to the overall development, the social environment of the child, the support system that the child gets from his parents, his family, his school, his friends, etc. The ability to make sense of new information is very crucial to successful learning. Cognitive issues may be responsible for learning difficulties in people with epilepsy, which may impact negatively on their academic outcomes and their behavior. Memory is a complex process, as we all know, this occurs exclusively in the brain. It occurs exclusively in an area called hippocampus in the brain. It allows us to store, retain, and then recall the information and experiences at a given point of time. Although not all people living with epilepsy experience such memory difficulties, it is one of the commonest challenges that a patient of epilepsy encounters. The type of memory difficulties that a person has, again, it also depends on the type of epilepsy, the underlying cause, and also the medications being used. Various support system and various support services are available these days that can help the patients to plan and navigate the learning journey. These can be further customized to suit the unique situation and needs of every patient. I hope this information will help all the patients out there with epilepsy. And in case of any other difficulties, do feel free to reach out to us. Thank you very much.